Welcome back, friends. Thanks so much for sticking with us. You know, when it comes to breast cancer, one treatment many survivors may need to think about is breast reconstruction. But the treatment is not a one-size-fits-all matter. So today, in honor of Breast Cancer Awareness Month, we want to have a conversation about it here in our LCMC Health Wellness Lounge. Joining now for the conversation is Dr. Ravi Tandon. He's a plastic surgeon at Touro. Thank you so much for being here.
Thank you for having me.
Yes, and come on with the pink tie. We see you. Thank you so much for joining us to talk about this really important topic, because like I mentioned, for many people, this is something they have to think about once they have beat breast cancer. But I have to ask you, is everyone who beats breast cancer eligible for breast reconstruction?
That's a great question. Most people are now eligible for breast reconstruction. You know, the question is the timing of the reconstruction. Sometimes, most of the time now, we try to do it at the same time as the oncologic surgery.
Okay.
However, you can also do it in a delayed fashion, and traditionally it was all done delayed. If you're generally in pretty good health, you're a good candidate for breast reconstruction. If you're not in good health for just surgery in general, then I would tell you we would try to tune you up and do your reconstruction in a delayed fashion.
And what's great about the treatment is that you all can adapt to whatever that patient needs, right? And there are so many different types of breast reconstruction, but there are really two categories. What are those two categories?
Yeah, so there's really two avenues: implant-based reconstruction and natural tissue reconstruction.
Okay.
And there's pros and cons to both. You know, implant reconstruction is very nice in the sense that all the surgery is done on the breast. Your only scars are on the breast. The surgery is a little bit shorter than natural tissue reconstruction. You could potentially go home the same day if you'd like. You know, recovery is about 6 weeks, but the first few weeks of recovery is going to be easier than natural tissue because you're only healing one site instead of two.
Oh.
The major disadvantage of implant reconstruction is implants are not made to last forever. And so, you know, depending on your age and your circumstance, you're more than likely signing up for future surgeries at some point.
Which one is more common, the one you just mentioned or the one you're about to talk about right now?
So that's a great question. Nationally, I would tell you that implant reconstruction is more common than natural tissue reconstruction, and that's most likely because of the skill set. You have to have the skill set to offer these types of reconstruction. However, New Orleans is very lucky. We have a lot of talented plastic surgeons in the area, and a lot of these natural tissue techniques have actually been developed here in this city.
It's so important to know that there are options out there because, like I mentioned, it is not a one-size-fits-all. I'm so curious about the actual procedure now, right? Whether it is natural tissue or implant-based. It all starts, after mastectomy? What do you all do when it comes to the actual procedure?
Yeah, so most of the time, so traditionally, all reconstruction was delayed. You would have the mastectomy first, and then the reconstruction could be months later. Today, we try to do it all at the same time. So you go to sleep with your breast and you wake up with a reconstructed breast. You can imagine the psychological advantages to that. Now, like I said, so implant-based reconstruction, we talked about natural tissue is where we take tissue from one part of the body and use that to reconstruct the breast.
Really?
Most commonly, I'll take tissue from the lower abdomen. So that's the tissue that gets thrown away, for example, in a tummy tuck. And we can use that fat to make beautiful breasts. Now, for that surgery, it's a little bit longer than implant reconstruction. We like to keep you in the hospital for 2 nights to monitor that tissue. Your recovery is 6 weeks, but you can imagine the first couple weeks are going to be just a little bit tougher because you're healing 2 sites instead of just 1 site.
And what's great is that, like you've been alluding to throughout this interview, there are options for everyone, but there have also been advances, really, since you've even started practicing, because about 95% of your work is breast reconstruction. Talk to me about some of the advancements.
Yeah, so right now, you know, I would tell you over the last decade, we've really refined the mastectomy as well as the reconstructive techniques. Historically, mastectomy techniques used to be fairly disfiguring. Today, we can save all the skin and nipple if it makes sense and is safe. And then the reconstruction techniques now border aesthetic surgery. You know, nobody necessarily is going to know what you had done unless you tell them. A lot of the times, it looks like a mommy makeover. Now,
are there any side effects at all?
Long-term side effects, not really. You know, the goal of all of this is after 6 to 8 weeks of recovery, you get back to everything you were doing before surgery.
This is fascinating stuff. You all are seeing some of the advancements right there. Really, really fascinating stuff, and there are more to come as you continue to do something like this. Doctor, I want to thank you so much for joining us today. Congratulations on all the women you're helping feel beautiful again. And look, everybody, in honor of Breast Cancer Awareness Month, Touro is offering a Pampered and Pink event at the Audubon Zoo Tea Room. It's coming up on Thursday, October 24th from 6 to 9 p.m. To purchase your tickets, log on to Touro.com/pampered. What a great conversation. And look, coming up after the break, we're talking with a nonprofit who wants to help people with breast cancer afford all of their medical needs. The name of that organization, Sylvia's Gumbo. They join us after the break. Don't